welcome to another Famhealth session. Today, I have the pleasure of being joined by Dr. Praveen Chandra, who is an interventional cardiologist at Medanta. And sir, thank you so much for being here with us today.
Thank you. Thank you.
We have been discussing with many cardiologists on this platform about prevention. In your mind, what are some steps that the average Indian, any of us can take towards living a more heart healthy or heart positive life?
Yeah. So many times people ask me the same question, that how do I keep my heart healthy so that I don't have to undergo an angiography or angioplasty or something like that. So the first and the foremost thing is that there are 4 or 5 risk factors which we have to understand, which are very common in the society. Beyond the age of 35 years, many people develop high blood pressure, which is known as hypertension. Now, hypertension is the silent killer. Hypertension doesn't kill. High blood pressure doesn't kill, but it leads to early heart disease. It leads to early stroke. And it leads to early onset of kidney failures. So we always say, if our people in the society take care of their blood pressure, keep it checked, keep taking the medicines, the kidney units will close down. Half of the kidney units of this country will close down. Let me tell you this thing. Half of the CCUs will become vacant because high blood pressure is something which is silent. Nobody knows about it. And it keeps damaging the body from inside. Okay. And that is why it is important to check the blood pressure. Beyond the age of 35 years, every person must get a blood pressure checkup done every year. That is number 1. Number 2 big risk factor is diabetes. Now, diabetes is also very common, and that also is silent. It has nobody gets a headache or a chest pain or anything. But when we get the heart problems, it is too late. So which means that the person is suffering from diabetes for the last 5 years, 10 years, 15 years. So anybody beyond the age of 35 years at least, or those people who have family history of heart disease, they should get their blood sugar checked at least once in a year, or in the initial period once in 5 years, but definitely once in a year after the age of 50 years, because they can develop diabetes. And when diabetes comes in, there are some bad cousins of diabetes, That's what we call them, bad cousins. Who are the bad cousins? The bad cousins are the heart disease. Once they enter your body, they will call the entire family. And the family is heart disease, stroke, and kidney problems. So don't let diabetes take control of your body. So people have to get it checked. People have to take care of their diet, exercise, and sugar, and then continue taking medicines. Because the biggest myth is people think that they should not start taking medicines early. Because if they start taking it now, they have to take it lifelong. The problem is, if you don't take it now, you will take it for a lesser period of time because the longevity will go down. So better start medicines early. And many medicines have been developed for sugar, for diabetes, and for high blood pressure, that the onset of disease of heart disease can be delayed, or it can become less severe. So that is why these 2 very important things. Then the third very important thing is, which is very modifiable, is that if you stop smoking. Many times people are taking tobacco, smoking, all that is absolutely no. There is no bargain on this. So nothing on that front, and you are protected. Then the 4th thing is cholesterol. So cholesterol is very important, and we have to understand that cholesterol, how do we know? It's also a silent thing. There is no symptom of high cholesterol.
Yeah, absolutely.
Yeah. So that is why we have to get the cholesterol test done by the blood test. It is done by a blood test. Everybody knows about it now. And this cholesterol has to be checked. And once it is higher, on the higher limits, then we start doing again a lifestyle thing. And if the lifestyle is controlled, cholesterol is controlled, no need of medicines. But if the cholesterol is high, despite family, despite doing all the, things in the family and their, lifestyle, we have to start medicines. So cholesterol is the 4th one. And the last one I'm going to tell you is absolutely non-modifiable. You can't do anything about it. And that is a family history of heart disease. So anybody in the family who has a parent or a brother or a sister or a sibling who develops a heart disease below the age of 50 years or 55 years, that means it is heart disease. The onset of heart disease, kidney disease, and stroke. So these are the five very important risk factors which have been very extensively studied. There is no if and but about it. Now, in India, the problem is we develop heart disease early in life compared to the West. And the problem is we are not so obese, we are lean, we are thin, still we develop it. So, which means that we have a genetic problem. Our genes are not tuned to take all the luxuries in life. We don't have to eat all the best things in life. We have to be frugal. We are from the frugal background.
Yeah.
So that is very important that we eat right, we eat less, and of course keep healthy from that viewpoint. The other two things which was studied in India, this is the inter-heart study which was done in India and with many other countries. And in India specifically, we found there are two other problems. One is lack of exercise. So all those people who do not exercise well, they will have the heart disease at least 2 to 5 years earlier than those who are doing regular exercise. Regular. It is not that you do it, once in a while and it's okay. No, regular exercise. Then vegetable intake. Vegetable and fruit intake, if somebody is taking adequate amounts of vegetable and fruits, it is healthy. Then that is what we used to do previously in 50 years back, 100 years back, and that is why heart disease was less. That is very important. And now the last thing I'm going to tell you is mental stress. Mental stress is really taking a toll on our lives through occurrence of heart disease also. It stresses the heart to develop a heart attack.
Thank you so much, sir, for talking to us. You just mentioned cholesterol, and I have a few questions about cholesterol. First, you talked about, you have to change your lifestyle if you are detected as having high cholesterol. So one, what do those lifestyle changes generally look like and why? And then I also wanted to ask you a little bit more generally about cholesterol. How does one detect it? How often should we be thinking about going to get tested for it?
Yeah, so cholesterol is one of the cornerstones of prevention and treatment of anybody who has heart disease or who doesn't have heart disease. So cholesterol should be checked, as I said, once in every 5 years for anybody who doesn't have any heart problem after the age of 35 years, and for every year in a patient who is diabetic or hypertensive. Now, once we find that the cholesterol is high, then the next steps are lifestyle modification. We give a period of 3 months to mend your lifestyle by diet, by exercise, by yoga. These are the three main things which we can do. And of course, being more active, and I'll tell you a little bit about the diet one has to take. So these are the lifestyle measures. And once the lifestyle measures fail, they don't bring down the cholesterol to our desired levels, then we have to start medicines. And let me tell you at this point that cholesterol medicines have changed the treatment of heart problem. It has reduced heart attacks, but it has to be taken. People just become very skeptical about it, that taking the medicine may lead to liver problems or some other side effects. No. The heart, for prevention of heart disease, cholesterol is the only medicine which has led to reduction of heart disease.
So one other thing that we wanted to ask you about, sir, today is, do you feel that cardiovascular disease affects men and women differently? And is there a trend of more women getting it now, or is it, we just wanted to get your opinion on that.
Yeah, that's again a very important question, because earlier everybody thought that heart disease is not as prevalent in women many years back, but that's not really right. Women are equally affected by heart problems. They are equally exposed to heart problems, especially after the age of 45 years. When they reach menopause, after that the protective effect of hormones which is there in women is gone, which means you are as exposed to developing a heart disease as any man beyond the age of 50 years. So that is there. So they also must get checkup, because many times I see the men are coming for checkup, the women are sitting outside. Why? They should also get a checkup done to find out if there is a heart problem. Now that's number one. Number two is, many times the symptoms which happen to women in the family, they are at home, people just start thinking, oh, it could be gas, it could be nothing, because everybody feels that it cannot be heart problem for her. But please do not take it lightly. If there is a symptom, it has to be taken in the same way as any male person has to be treated or investigated, etc. That is number two. And number three, a very important thing is, heart disease affects women in a very, very severe way. When they develop it, the chance of dying is higher.
Wow, I didn't know that.
And chance of getting affected is much, much more intense. So women are intense in any way. So when the disease comes, that's also intense. So we cannot ignore or neglect women in the society, both for prevention and treatment of heart disease. They have to be treated aggressively. We cannot just say, okay, no, we can check it later or do it later. No, it has to be done.
Also, there are, of course, some women in India that don't necessarily have full autonomy over their treatment plans. And so I think definitely discussing women's health and, listening to women about their health problems and taking women's health more seriously is really a need of the hour in India.
Absolutely. I totally agree with you that women have to be considered, they should be treated and they should be taken care of in even better ways than men. People have to take all kinds of food. It has to be a balanced diet. It doesn't need to be boiled food and kind of bland food. All spices are okay. Even if a person is having a heart disease, he can take all kinds of spices. He can take all kinds of food. He can eat everything. But to control sugar, he has to bring down the sugars, the direct sugars, and the most important thing is the direct sugars should go down. Sweets should go down. More of cereals, vegetables, fruits, even meat is okay. So many times people have a myth that I cannot take red meat. No, they can. Any meat which is lean meat is okay. And fish, chicken, eggs, everything is okay. So even if a person is a heart problem, no issues, take everything in a balanced way. Okay? And then the second thing is very important is that many times, after the heart attack or something, people come to me after 3 months, very, kind of loose and dilapidated. What happened? He said, I've been taking boiled vegetables since 3 months. I said, why? And because we have our habit of taking normal, food, which is having some little bit of oil and spices and masala. It's okay. Please do that. And the last thing about oil, every oil which is a vegetable oil or even deshi ghee is okay. So that can be taken, no problem. Because oils do not increase cholesterol directly. It is our body which makes cholesterol. So oils can be taken in a balanced way. I'm not saying that you start eating puris every day, but what I'm saying is that you can certainly have it, no problem. You don't have to just be away from that. So whatever gives you pleasure, please do that, but do it in moderation.